letterhead continue.
Your speaker down.
And good morning. We will be starting shortly. We are still waiting on Sarai though. But hopefully she'll get in soon. Again, if you didn't see the message, we are taking attendance by using the chat box. So if you could put your first and last name along with your agency in the chat for us this morning. Thank you. And if you have questions, please utilize the chat box as well.
Annalyn, are you in?
Good morning, all. It looks like Saretha is now here. Just want to make sure. We have a couple of more people that we are admitting, but I will toss it over to Saretha when she's ready to start.
I'm going to go ahead and get us started. Good morning, everyone. So go ahead and toss it to me, Tamela. Everyone I'm glad you are able to be here. I know our weather is treacherous yesterday and today, and listening this morning, and the possibility of some lake effect snow. So we're not done yet. So I hope everybody is safe and taking it easy out there. I wanted to come together this morning with those of you specifically funded with our Early Childhood Block Grant or PFA PI to talk you through a few concerns and also to find out a little information from you as well. And so we're going to be talking about funding and enrollment and some other pieces of information that's important for you guys to have. So I'm going to go ahead and say, get started with the slides. Go to the next slide, please. And so asking everybody to put your name, and I can see people are doing it, getting all the information in, because this is how we're tracking attendance. So I thank everyone. Next slide. And you can go ahead to the next one, that's fine. And so for me, I just want to make sure that everybody understands why we're doing this meeting, and we're going to be doing these a little bit more often. It's hard sometimes when we're giving information in our combined EDPD meeting, when there's specific information for Head Start or specific information for PFA PI. And so what we're going to do at intermittent times, we're going to pull away and make sure that we have time that we can spend specifically on this fund to make sure that you understand what's going on with it. And that way we can answer your specific questions and you don't feel like you're getting lost in that conversation. And so I thank you again for joining us today. Again, we will be doing these at intermittent times. We will still do the joint meeting. We have had a separate one for the federal, those that are federally funded. We're going to do separate. We just want to keep everybody informed and keep everybody on track, and specific information that's related to you. Sometimes we need to be right there with you, and that's why we're here with you today. So the first thing I want to do is talk about reporting and data entry. And I know William's going to talk about it a little bit later in slides, but I just want to remind everyone, I'm always listening to your concerns, Devana. I'm here. I want to make sure that everybody is getting from us what they need. So, you know, I've heard that we needed to do this, and we're here today, and we'll be doing these. So again, reporting and data entry. One of the things I need everybody to understand is in the COPA system, where you are putting your information, where you are enrolling your children, what we are finding today, as we have been over the last few years, is that we're enrolling children, but we're not putting all of the information required to complete that enrollment in COPA. Then when it's time for us to submit reports to CPS, for them to get their full report to ISBE, what they're finding is that there's data sets and data points that are missing. Then my team are trying to work with all of you, and it takes several weeks. But what we want to do is we want to get to a point where our information is clean each month, and we can do a direct send over to CPS versus going back and forth and updating data. And so if there's a necessity for training more staff on what the elements are, we're here and we're available, and we'll definitely work with you. But we have got to get those screens completed. We've got to ensure that the children that you've enrolled in ECBG, either PFA, PI, center-based, home-based, however you're serving them, if they're in doula, and I want to thank you for those of you who have the doula fund and you are enrolling yours now that we've got everything set up in COPA. And I went in to see if I had any children that said doula before this meeting, and I do, so thank you. I just need everybody to really talk to your staff and make sure that they're completing all of the required elements on every child that's enrolled in your program. What is happening is when we can't do that, those are children who can't be counted. ISBE can't then take those children and include them in the monthly report. And so now we're down in enrollment. You may be serving children that are not being counted. In addition to that, when it comes to the IEIN numbers that are required for teachers in classrooms, if they've not gone through the process and they don't have that number and that number's not in there, that's a classroom with however many children you have in it that can't be counted. We need every classroom counted. We need every child counted. Therefore, we need our reports to be clean, data to be entered, and making sure that everything is up to date on every child and every staff in your program. Again, I know William's going to talk about it a little bit more, but I just needed you to hear from me. This is urgent. This is critical. I know we're doing better, and I'm going to say that because my staff, I know, have been working hard, and we're doing better now than we had been before. So I thank everyone, but we're still not there yet. But we still have records right now that are in the hands of CPS that are not complete, which means those children and/or classrooms cannot be counted. We can't continue to do that. We've got to get everything done, and we've got to get them in, and we've got to get them right. I'm going to come back and have questions and answers later. I just want to get through some of the things that we're talking about because I do need to put some numbers in front of you because I need to have you see where we are with some of this. I know when we were doing the Head Start, Early Head Start, and combined meeting with PFA PI, and we talked about vaccine mandates, people were concerned that I was saying that everybody had to follow the federal mandate. What I'm saying, and I want to be really, really clear with you, If you're federally funded and ECBG, you still need to follow the federal fund, because the federal one has a mandate. They have a mandate. In order for you to still be in accordance and in compliance with them, you've got to follow that. For home visiting, yes, testing weekly is still okay by the state mandate and everything that's out there. We sent to everyone via our CSD update, the updated licensing guidance. And so I need you to have the licensing guidance. If you're licensed, I need you to have what we're sending you from Head Start and Early Head Start, from Office of Head Start. I also need you to get what we're sending you from the state. There's a lot of information that's going on, and some of it in some cases are competing forces. But I want to take you back to something I said earlier on regarding vaccines. You are independent organizations and you have personnel and HR policies that you must update. Your personnel policies and procedures, when there's a change, for example, in a requirement, you need to update your personnel policies and procedures and make sure that is now in the hands of all of your staff. For vaccines, for example, there's vaccine mandates for staff and licensing. So your personnel policy right now should be speaking to the requirement for those vaccines that are required for licensing. In that section of your personnel policy, my recommendation was and is that you look at that and update it for this vaccine as well, to make sure that your staff understand from you, what is my requirement in sitting at your organization for me and my vaccine. And I need you to do that. I need everybody to look at their organization and make sure clarity of messages out there, that people understand exactly what it is that you're saying to them. I do have some organizations who are making some determinants about hiring or not hiring staff without vaccine, and organizations, because you are your own legal entity, have a right to do that. I'm not going to step on anyone's toes, but I am going to ask you to follow guidance. I'm going to ask you to make sure when it comes to vaccines that in COPA, where we have now put in COPA an opportunity for you to keep us up to date about vaccines, that you do that on behalf of your staff as well. Keeps us up to date, lets us know what's going on in our community, lets us know what's going on with our staff. And so I do need everybody to understand where all of this is coming from. Yes, there are multiple forces out there regarding vaccines. One thing I said at the EDPD meeting previously, there was a lawsuit, a federal government lawsuit against President Biden's initiative to say everybody in organizations 100 or more must be vaccinated. That failed. There was a lawsuit and Supreme Court threw that one out. But that does not stop the federal government from saying to its federal funded agencies that their staff must be vaccinated. Hearing this morning, some of those in the armed forces are hearing today that if they have not met the federal mandate, that they too are going to be subjected to it. And so I just need everybody to understand, in the state of Illinois, Governor Pritzker did put out a mandate, and that one was for vaccines at the end of last year, 2021. The one for the federal mandate was through January of 31st, or just a few days ago. And so based on your fund, and we're giving you information, please read it. And if you have questions about it, then reach out to me, but please read the literature and the information that we're sending to you. We're sending out CSD updates a couple of times a week, trying to keep you informed on what's going on around you and how things impact you. So again, if there's questions, we will definitely be able to answer those. Enrollment. We are under enrolled. I don't think anybody's shocked by that, but we are under enrolled. And under enrollment also impedes us as far as some of our fiscal pieces as well, and we understand that. But we also want to make sure that in your organizations, you're thinking about what your enrollment strategies are. What are you doing to try in order to update and enroll more children in your facilities? There are plenty of children out there. I'm not going to say every child and every parent is ready. And we get that. Every parent isn't ready to have their children in center-based programs. And we know we're still going through some of that because we're still in a pandemic. But what we want to do is make sure that our doors are open and that we are enrolling children. I want to make sure that everybody understands, if you accept children that are CCAP, that under the new CCAP regulations, you're able to enroll a parent who is not employed or in an activity right now, and they can get 3 months of consistent childcare through the childcare assistance program while you work with them to help them find a job or get back in school. Then you've got a child who's not only in your program under another fund, but now you will be able to attach that CCAP fund to them as well. So keep up with the changes that are going on, because it's a lot going on around you in this era right now. But enrollment, we know that we're getting further into the year. We know that, right now, if a parent wanted to right now, we are in the city in a snowstorm. But what's your plan when the weather is a little bit better? What are we going to do to encourage more parents and let them know that you have vacancies at your particular site? And so one of the things we do every year is we do launch the application. The application, again, will launch around April, letting all parents know that programs are available, that it will launch for program year 2022-23. The iteration of this one, we are hoping, and if everything goes well, it will be a 0 to 5 application. And so parents across the city will be able to see options for birth to 5, not just 3 to 4 as we've done before, because we want parents to go onto these sites and see your site and understand that they can enroll in your program. So we're doing a new polished and a new updated universal application. And so look for news about that. And some of you, we're going to be asking you to help us along the way with that as well. But again, in enrollment, we want to help you. We've been doing some initial talk with our vendor to get more information out there. I do know that it opened up for you to ask for what you wanted for enrollment materials. If you've not done that, we want to make sure that you get your enrollment materials. And I know there's been a lag before, but what we're trying this year is to get CPS's enrollment materials and your enrollment materials around the same time, so that your information can go out in community as well earlier than it has been in the previous year. So I do want you to know we're working on that. We're gonna do a lot of talk about fiscal, but with fiscal, and I'm just gonna quickly say, we've asked for monthly vouchers and everybody's not doing it. And so we're gonna go into some slides in a little bit to show you where we are. And then we're gonna talk about it, because where we are, we're not in a good place with this particular grant. We're just simply not in a good place. And I need to say that to everybody. And I'm gonna explain a little bit more about the not in a good place, but I wanna put the numbers up in front of you because they, I think, will send the message loud and clear what I mean by it. But we've gotta be much more fiscally sound and responsible when it comes to this early childhood block grant and making sure that we're actually utilizing these dollars. We had what I consider massive underspend on this grant list that closed out June 30th. I want you to hear the number so that you can understand what this is. We sent back to the state of Illinois, or back to CPS, $12 million. I need to say that again. We sent back to CPS at the end of our year, after all of your invoices and everything went through the system, $12 million. We cannot do that again. The reason I wanted to have this meeting early in this year, so that if there's some changes or something we need to do differently, that we have an opportunity to look at that, and you can do some strategies and start thinking about what you might be able to do within your program, so that we can use these dollars versus sending these dollars back. And so we're going to be talking about that. I do see a question in the chat. How will university enrollment application work if we receive EHS and HS from another grantee? I will say, talk to your grantee to see what their decisions are about the universal enrollment. We had conversations, and right now, if they are, for example, funded by us for any funding source, and I will say some of the grantees are funded by us still. They may be grantees themselves, but they're still funded by DFSS for under other funds. And so we are expecting and anticipating them to be within our enrollment system still. And so please, for those of you who have your federal dollars under another grantee, talk to them about their interest in being in that universal application system and having your sites available for parents to see. And so please make sure you have that conversation with your grantee for your federal dollars. Next slide, please. So one of the things I want you to see here is where in FY19, the award for the dollar amount for PI, Prevention Initiative, was 39 million. We expended 37 million, so we expended around 95% of that grant. In FY20, the award was 44 million, and then we expended 40, went down a little bit, we expended 91% of that. And so again, we've not been at 100%. We are underspending on our PI grant. And this is what I'm talking about is we've got to do better. We've got to get monthly vouchers in. You got to do work to make sure, I know my staff contact agencies to say, where are your vouchers? We're on our side, and we're going to do more of this, much more personal and upfront, and much more often. Next slide. And then we hit FY21, and we only expended 89%. And so we left money on the table, okay? And we cannot continue to do that. And right now, what we're looking at based on what we have in our system, as far as your invoices, we're definitely on track to do a massive underspend again. And that is not something that we can continue to duplicate. Our funder, our dollars come to us from CPS, and they're just not going to allow us to continue to have these dollars at these levels if we're not expending them over the program year. And so, your dollars come out and are funded July through June, and our fiscal year closes. They look at everything. And right now, this is what it was at the end of FY21. Next slide. And so for PFA, the 29 million expended 27, again, hit that 93% mark in 19. And then in 20, a little bit more money on the table. We expended 30 million of that. Again, we went down a little bit. We got a little bit more money, and we expended less at 92%. And so again, even with our PFA, we're not expending 100%. Next slide. FY21, 32 million on the table. We expended 28. We left money on the table. It was 87%. And our underspend for FY21 was $12 million, as I said. That's huge. It's a lot of money being left, a lot of money that, for me, should have been in your hands, serving families, doing what was necessary at your organizations, and it didn't happen. And we've got to figure out the why behind that. What's going on while we're not able to actually use the dollars that are being awarded in your contracts? Why are dollars being left on the table? And I understand, and let me say this to you. I understand that we've been in a pandemic for the last 2 years. I am not blinded by that. I also know that we have staff shortages in Chicago, and it is a national trend as well. So I'm not blinded by that either. But I do want us to think about what else we can do to make sure that we are maximizing every dollar that we can at our agencies. And then if you're not able to acknowledge that early enough so that we can make some budget revisions. What has been happening is I will ask my staff to reach out to agencies and say, are you going to expend your dollars? And there will be some people who will go, no, I'm not on track to do it. And they'll give us what they believe they were finished. Many people will say we're going to spend every dollar, but then when we get down to the end of the year and we look at all of your invoices, you've underspent. And so we're going to be looking again and talking and finding out where people are and trying to figure out how we can get beyond this problem that we have, which is the consistency of leaving dollars on the table that's going back to CPS. What it would look like, and I hope it would look like to you as a funder, that these dollars just simply aren't needed in these agencies because over the years, as you've just seen, we're underspending. And so we've given increases in rates to help you to have more dollars for salaries and other things on your side of the house, but we really need to get to the bottom and figure out what's going on. Next slide. And so here's some top reasons for underspend. And Tiffany's not here, but I know she's been talking to a lot of you, trying to figure out what are you saying are some of the issues and what's going on your side of the house and why are you not able to do it? And so here's some of the top reasons that's been given to us for underspend. Pandemic related reasons. I'm sure, we could really line those and really talk a little bit more in detail about what some of those are. But again, I mentioned it, I know staff shortage, some resignations, some people moved, they got other jobs, they changed careers. And we know we're in a competitive place where we are looking at how do we figure out how to keep staff, and we know we're losing staff. We're losing staff to agents, to entities outside of the city of Chicago's programs because they have found that they can get higher wages in other places. So we're in a competition. And I know we used to say, a lot of the competition were for positions in CPS. But some people are just leaving the fields and changing careers because they're able to find jobs that are paying higher salaries, and they're choosing that for themselves and their families. And I understand qualifications and staff qualifications is an issue. And we know that we don't have enough staff with the right credentials across the board for all of these positions. Low enrollment, talked a little bit about that. Cash flow, we need to talk about some of those things with agencies themselves who are having cash flow issues so that we can see if there's anything that we can assist with on our side of the house. I understand the contract execution delay is a problem, and I understand that, and I own that on our side, meaning DFSS. We understand that if you don't have a contract in your hand, you're not able to invoice, you're not able to actually do your business when you don't have your contract. There's work being done right now at the city of Chicago to try to work on some of this. I know Tiffany sits on a meeting that has, with other departments in the mayor's office. We're trying to figure out what we can do to make sure that those contracts can get out and executed earlier. But one of the things I also want to say to you in contract execution, and if you get your contract and they're asking for documents, please immediately make sure that you're responding and getting your information in. Sometimes we're going back saying, we still have not received a document, which means your contract is still waiting. It can't be executed if they're still waiting on documents. They're, doing some work now to try to figure out ways of looking at what documents need to come in and how those documents can come into the city in a much more expeditious way. So I know there's work being done. We all acknowledge that that is one of the issues, and we're working on it. Procurement delays due to shipping, ordering items and not being able to get them in. And I've heard that multiple times from people that those are issues out there. They have placed orders, but again, in a pandemic, many people weren't able to get everything that they thought they were going to be ordering, especially a lot of the PPE. A lot of the things that you wanted to get were short, and just everybody were not able to get those. I'm going to go to chat. Is this contractor delays due to pandemic? A lot of things were not able to be done that we had planned for because of the pandemic. And you may have been working on a classroom, doing some other things and couldn't get all of that done. That could be an impact that would have caused you to not be able to expend your funds, and we understand. And so we were asking, what are some of the reasons? And these are some of the things that came back to us. I'm looking at the chat regarding spending. The city's cutoff for calendar billing versus fiscal contract are a barrier to ensure that all costs are billed. I will definitely take that message back. I think Nicole Roberts from our fiscal team is on here as well. Maybe giving examples of, I'm trying to get down to it, giving examples of expenditures that we can use. We can definitely do some of that to try to figure out other things that might allow you to actually use some of these dollars so that they're not just sitting there. And so we will definitely be looking at that. We will definitely be trying to do more communication with you around this. I want to go to the next slide that's here, because here are some strategies that Tiffany has put together for you. Looking at your actual and projected salary turnover, repurpose your funds, submit monthly vouchers at least. It's okay to voucher each payroll to increase your cash flow. You don't have to wait to have, if you do payroll twice, you can submit twice a month. You don't have to wait and do it monthly. Get your voucher in for, payroll A, and then get your voucher in for payroll B. No one is saying that you can only do it, monthly. We're saying at least monthly, but you can voucher multiple times a month if you need to make sure that you're getting your dollars in your hands. When you're faced with low enrollment, allocate more resources to some of your recruitment efforts. There are things that you can say you're using your dollars for to help with your enrollment that are eligible resource activities that you can actually put into your billing and can be refunded for. And so again, looking at some of that and other ways to think about what else can you do. The contract execution delay, if there's some things that are going on, Tiffany, Monica, your PFA accountant, your contract liaison, please contact them. If things are still not happening, say to somebody, I haven't gotten mine, so that they can then do what they can to at least go up there and say, hey, where is this for this particular organization? And we rely on you to let us know when you don't have, because there's so many things caught up in systems. Sometimes we can't see it, but we can go to the right person and ask, where is this for this particular organization? If you know you want to order something, don't wait until later in the year, go ahead and place your orders early. Make sure you have things for your program year, if you, so that you can have those things versus waiting till the last, and then you're trying to utilize dollars and now you can't get your shipment in, you can't get your supplies. Vendor is saying not available, but these were things you projected to purchase. Now you can't get them. Again, dollars that you won't be able to expend if you don't have another idea. Submit your budget revisions as needed. There's no limits to the frequency. Until the last call is made by finance, you can still do your budget revisions. Revise your budget. Make that budget a living document where you are changing it when you need to, so that you are able to expend the dollars that you have. Work with the team here to figure out what things you might be able to do so that you can get those other items in that budget. So when it goes through, it's not going to get lined out. You've done a budget revision, it's been approved. Now you are able to use some of that. Belinda, I see you say right now you have 3 unpaid vouchers in iSupplier. I'm going to ask you to reach out to us and make sure that we know that, so that, and I would say, I know that Tiffany is not here today, but I'm going to ask you to reach out to Nicole Roberts, who's our fiscal person, to see if there's anything that we can do to find out what's going on with your vouchers, what's the holdup. We do know that we've had some staff issues at the city level, which is outside of us. We know that there's been some, individuals in varying departments at the city of Chicago that has caused some of these delays, but I know they're doing everything they can to get those seats filled and get things out of the door. But raise your hand and let us know if don't wait. Let me just say this. Don't wait until you get into a crisis. The moment you put your vouchers in there, and if you are not getting something within a turnaround of about 30, 45 days, raise your hand and say, I got a voucher waiting. And don't not do the next one because you're still waiting on one to come. Please, please, please continue to invoice consistently. Let's get these dollars out of the door this year. Let's not hold the dollars in, and let's not turn dollars back. I would love 100% on PFA and PI to be expended this year. Anybody else? Hopefully somebody else out there is going, yes, let's do that. Wish you were all in the same room with me, because I'd walk around and we'd all sign this document talking about what we're going to try to do. But we need to do everything that we can to try to make sure that we're expending as many dollars as you can. I love it, Devonna. Yes, we will do that. Thank you. We will. Let's plan for expending all these dollars, because the other side of not expending these dollars is the funder asking for the dollars back. And I want to say that in front of you, is they have the ability to say, you're not able to expend the dollars and we want to take some of those dollars back. So I really need you to work with me. That's why we're here today. That's the purpose of this meeting, for me to be really, really clear with you that we have done this for too many years. We can't continue. We've got to show that these dollars are needed in your programs. And the only way we're going to be able to do that is that we continue to expend these dollars. Dottie, I see you have a question on here. And I'm trying to get it to open all the way. Budget revisions need to be processed on a timely basis. We've been waiting several weeks for some of our revisions. Dottie, please reach out to my fiscal, to Nicole Roberts, again, making sure that we know that you've got that one waiting so that we can get back to you on your revision. So thanks for raising that, but please reach out. Don't just wait. Don't keep waiting. Everybody, please. Make us do our job. Let me put it that way. Make us do our job. Stay on top of us. Let us know what you don't have so that we can continue to communicate with you and work with you and help you as best we possibly can from our seats.
Sarita, I think,
Go ahead.
sorry, Sarita, I think we missed a comment from Cheryl Collins
Okay, let me go
in the
back.
chat.
Okay, can you see it?
Yes, she says, what is the expected turnaround time when we submit a voucher? We haven't received payment from our December voucher yet. Also, should one submit the January voucher while waiting for the December voucher?
Thank you. Thank you for catching that, Berenice. So to your question, and it's twofold. One, I'm saying if within three to 4 weeks you haven't received anything, you need to say I haven't been paid. You submitted, I'm not sure exactly when in December you submitted it, but we're in February now. You should be expecting payment. And so you need to be checking and finding exactly where that voucher is. As far as the sending in a voucher, yes, you can voucher while you're waiting on another voucher. I will, make sure that I'm right on that, because I'm not the person in that place, but I will ask Nicole Roberts when she speaks to respond to that. It's my understanding you can have vouchers in waiting on other vouchers. So don't wait, but don't not communicate. Please let us know when you're waiting beyond an expected date. If you haven't gotten something in 30, 45 days, please let us know. Because that's the issue. That's what we want to do, is turn these around. We understand you need resources in your hands. You've got to pay salaries. You got to do all of these different things. And we really want to work with you. And so the answer came back in and it says, yes, you can submit multiple vouchers without having the previous voucher approved. Thank you. Another suggestion is for the PFA award to be the full 12 months rather than 10 months. This will help agencies spend the funds on a regular basis rather than stop and go for 10. That's the way the award comes out from us, because the PFA is intended for a school year. And so I'm going to keep that as a note for myself. And I know that was a question before. And I'll see if there's any thing that can be done about that. I'll lift that one on your behalf. Does anybody see any other questions that I've missed at this point?
No.
Okay, next slide, please. So ECBG enrollment, September 2021. Now we're going to look at enrollment. So we're going to pull up a document to show you some enrollment. And so Cheryl Collins said, yes, we operate. Yes, we operate over the summer, and the 12-month payment would be helpful. Please fight for that, Saretho. I will, you know what, I'm one for fighting, you know, and I will let you know what comes back. We shall see. All right. Thank you. And so what I want to show you now is enrollment. And so where you see some of the highlights, these are your programs. Go up to the top for me, whomever is.
So you can just, yes, scroll.
Okay, thank you, Song. Okay, so what we are doing, and we're looking at year over year enrollment. And so what we're trying to figure out is what's going on with enrollment versus what your slots are and whether or not you are enrolling. Some of you, as you can see, you know, you're over, but we have some under enrollment, and it's over the 4 months that we've been operating this program year. And so where we are under enrolled, we need to really talk about what we're going to be able to do. Because again, that enrollment, you know, ticks right back to your funding, ticks right back to the underspend that we're all acknowledging that we cannot do again. And so scroll down a little bit more where you see the highlights, what you see, green, it's, you know, pretty good, getting close to that. Then we're at, you know, the orange and reds. You know, I've got one here where I see a 17%. I see 0% for a couple for the first 2 months, and then it ticked up in November, December, but we've got to continue our enrollment. Some of that may have been getting staffing, getting a classroom opened, but it's an issue for us when we're under. It's an issue for us when you're not operating a full classroom. It's an issue for us, and it becomes an issue for you, and it becomes an issue for the fund. And so one of the things we've got to do is we've got to make sure that our fill rates are better. Let's work together. Let's talk about this. Let's figure out what else we need to do. I do understand staffing issues. I understand parents who are not ready yet. What can we do? We've got to think this through, because one of the things that we need to do is get our enrollment up across all of our programs. And so if you go down to the bottom, the grand total here, September, we were 60% enrolled. If we look at October, we were 65% enrolled, ticked up. November, 69%, and then at the end of December, 72%. But our average was only 60%, 66%. And so I see Victoria saying, but Learn's number is incorrect. Let's talk to us and help us understand what's incorrect. As an individual, I'm writing a note that Learn is saying their number is incorrect. What these numbers came directly out of our COPA database system. And so if there's something that's missing in there, we will be wanting to work with you, Zuli. I see that you're saying that your numbers are wrong as well. And again, this goes back to the enrollment and what is in the system that is reporting on you. And so when we pull reports, and that's why we're doing this for you, when we pull the report, we're pulling it from the system. And this is what the system has as records in the file for children and families in your organization. And so if it's totally wrong, if it's totally wrong, It's totally wrong on your side, but it needs to be fixed in the system so they can be right on my side. And so we've got to work together on this. And so I see It Takes a Village September number is incorrect. I see you, Gwendolyn. I see, incorrect. Let me say this. If it's not in COPA on that end of that month, if it wasn't in there and it wasn't a full record for a child, it's not countable. Okay. And if it's not countable, it means that that's a child's record who's lost in a number that's lost for you. Can we have a copy of this report? September is incorrect. We're going to give you your enrollment numbers so that you can see them, so that you can work within your internal system. I just wanted to put it up there so everybody can see. When we're pulling these reports out of COPA, they may not be accurate if all of your children are not enrolled and all of the data that's needed isn't pulling into that report. Then it's not going to end up being a enrolled child. And these are issues with the enrollment. And that's why I'm putting this in front of you, that we really need to work together on what's in our systems, because on your system, you're looking and feeling like you're doing one number, but that system is speaking to another number. The total ECBG is both funds, Head Start, PFA and PI. That's total ECBG. So if you got PFA and PI, regardless of model, then that's your total number for your enrollment. And if the numbers are wrong, you can pull it down right now, Song. We will work with you. We will give you the numbers that we have. We've been trying to enter kids, but they are in someone else's system. We put in tickets. Then we will be talking to Craig to see are these tickets that we can resolve on our level, or if it's something that we need to work with COPA on. Thank you, Zuli. We need to get COPA separated from our previous partners so that our directly operated sites are on their own entity. Megan, send me an email. Let's talk about what it is that you need. I'm going to put my email in the chat for everybody, but please send me an email and let me know exactly what it is that you're asking that needs to be done for your organization. Let's go back to the slides. All righty. I'm going to stop talking for a moment. I think B is on.
Thank you, Srapal.
Thank you.
Good morning, everyone. I just have a couple of reminders and a few updates as it relates to health and safety. We are still in a pandemic, as Srapal pointed out. So I want to remind everyone to please stay vigilant with appropriate masking. What I mean by that is it needs to cover the nose and the mouth to be effective. Please remember to continue social distancing, hand washing, and daily sanitizing. This all helps to reduce the spread of COVID. I'm dealing with a little something myself this morning, so bear with me. Hearing and vision update. DFSS has coordinated with CPS Child Fund to be able to provide to PFA only programs to schedule hearing and vision dates for your families to go in and get screened. These are our programs that aren't connected to either a DFSS delegate agency or another federal recipient agency. So these are what we refer to as our PFA only sites. If it applies to you, we will be sending you next week Child Find sites that are located all across the city in libraries and schools. You will receive the contact information, the locations, and the hours of operation. We will be working with you to ensure that you get these dates scheduled, and you can reach out to me if you have any other questions regarding this. And with that, I'm going to turn it over to Gina Pasella to talk a little bit about disability services. Gina.
Thank you, Bea. Good morning. My name is Gina Pasella, as Bea shared, and I am a Chicago Public School CPS DFSS Disabilities Team Leader Facilitator. And I am very happy to be here today to share with you that our team continues to support the PFA PI programs, your programs, and that we want to encourage you to continue submitting your referrals for children with suspected disabilities. For your children who are 3 years to 5 years of age, you would submit your child's referral packet to our subject matter experts to request a special education evaluation for those students. For our prevention initiative programs, you would make a referral through our State of Illinois Early Intervention Program. And that is simply a phone call, sitting together with the family to make that referral. But we are here to support you in that process. And so if you have any concerns about children, questions about how this happens, please reach out to us. We work very closely with the DFSS Education and Disability Support Service coordinators to ensure that the referrals happen in a timely manner. In addition to that, as Sarito mentioned this morning, it is so critical that all of that information is entered into COPA with regard to how the children performed on their developmental screenings, their social emotional screenings, when a referral is needed, that it's entered as soon as the need is evident, and that you are regularly updating the students' referrals in COPA to reflect that it's in progress or the child was found not eligible. So we really need to see all of that data entered in a timely manner so that it can be reported to the state, it can be reported to all the powers that be. In addition to that, in terms of referring children, we also want to encourage families to seek the services that the children are eligible for. And we know during this pandemic that that has been very challenging for families for a multitude of reasons. With early intervention, there was definitely a delay in which EI moved from in-person services to the virtual model. And we know that families had concerns about accessing virtual services for our birth to 3 population. And that's similar to our 3 to 5 population. We still see that at Chicago Public Schools, many of our diverse learners are not accessing their IEP services. And again, there are various reasons regarding that. Many of you know that transportation is a major barrier at this time for our children. It's a nationwide shortage. We don't have bus service. We don't have bus drivers. And so we're seeing a lot of children who are not accessing their services. Of course, this is a high level concern for all of us. And so again, we're here to partner with you to reach out to help you troubleshoot these issues. I do want you to be aware that for families who are not receiving their children's IEP transportation services, that family may be eligible for a stipend monthly up to $500 in order to secure their own transportation to services. And so if you have families in this case, I'd like to provide you with the CPS transportation contact information so that you can work with your families to reach out to CPS and see if this applies. If it's okay, B, can I put that email address in the chat?
Thank you, Gina. Yes.
Okay, wonderful. So we wanted to share that with you. Again, we encourage families to reach out to the email that I'll provide in the chat, provide their child's name, their date of birth, and they will receive a response from our student transportation department with regard to whether or not they're eligible for that stipend. And then before I leave you, I just wanted to share a couple of additional resources for you. I hope that you're all familiar with the Resource Center for Autism and Developmental Delays. That is also known as RCAD. And they are a wonderful resource for your teachers, for your families, particularly for children who we suspect have developmental delays or perhaps are on the spectrum, the autism spectrum. And it's a free resource. They have wonderful materials. They have free trainings for families, for teachers, tips and tools for homes and schools supporting children with autism. They have a lending library. You can go there and laminate materials. And so we always encourage our teachers and families to check out those centers. There are 2 locations, one at 10 South Kedzie and the other at the King Center at 43rd and Cottage Grove. And so if you're not familiar, name the center again. It's called the Resource Center for Autism and Developmental Delays. And I can also put that in the chat if that's okay, B.
Yes, that's fine.
Okay,
And
great.
we also have flyers that we can.
Excellent, thank you.
Thank you.
I'm sorry, Gina, you have a question about who's the contact, the email contact for referrals, if you could place that in the chat also.
So I would say that if you have questions regarding referrals for children with disabilities, you can always reach out to your Ed and Disability Support Service Coordinator. And they definitely work very closely with our SMEs, and then we can troubleshoot with you specifically regarding that child. And so hopefully all of you know who your Education and Disability Support Service Coordinator is, but I would encourage you to start with that individual.
Thank you, Gina.
Thank you.
And when in doubt, you can always email me as well, and I'll put my information in the chat. Last reminder for us under health and safety. We realize that DCFS is very backlogged. We have been receiving DCFS final determination letters that are even a year old. So please remember to keep your monitoring team leads, Nicole and Jacinta. Please keep them updated. Notify them immediately whenever an incident happens at one of your sites. We see as major incidents when DCFS is involved, when Chicago Police Department is involved, if you have to rush a child to the hospital from your center for any reason. If you're in doubt about what's a major incident, if you need to report a minor incident, don't worry about it, just report it to us. There is an incident reporting form that we would ask you to use. And again, you can reach out to your team leads to get that form. So that is it for the health and safety updates. Thank you.
Thanks, B and Gina. William?
Yes, thank you. Good morning, everyone. A few updates as it relates to our quality and program development unit. As Sarita mentioned at the top of our meeting this morning, data entry. And so what our team has been working on is an internal assessment of the data that we currently have as it relates to your enrollment. And so this ties directly to one of the slides that we previously saw, and I saw the chat kind of light up with, hey, the numbers are wrong, the numbers are wrong. And that is indeed for various reasons. And again, one of the top reasons we're seeing is with the funding sources. So we definitely want to make sure that you're tagging and linking the children under the direct funding for their programs. So what our team will be doing in this next iteration of reporting this information to CPS and ISB, we will be using that last slide as relates to your current enrollment and matching that towards what you're funded for. We'll be reaching out directly to your site, your data entry, your enrollment specialists or program managers, whichever you prefer, to kind of help you work through these enrollment numbers. If it says you have 75 currently enrolled, but you are issued 100 slots, we want to make sure that we have 75 complete records for 75 children. So therefore, we're up to date, and we're looking to work through this task within this month. So please look out for that. And again, that's for all of our ECBG, PFA, PI, our prenatal, and doula through all modules, center-based and home visiting as well. Also, wanted to share some great news. We're working in conjunction with CPS on our Supporting English Language Learners initiative. And we had our first focus group was held on the 27th of January. So I just wanted to give a shout out to those agencies that did join and give support to this citywide initiative for supporting English language learners. We'll make sure we put another update in our upcoming CSD, so that if anyone else would like to join that focus group, the more the merrier, to help us support this very important work across the city of Chicago. We're also planning for our assessments. So we know that right now, as B just mentioned, we're still in this pandemic, and it's very important that we still work to mitigate the spread of coronavirus and its various strands. So therefore, we are going to be embarking on class assessments virtually again this year. So please be looking out for our team response, and please be responsive to some surveys we have coming out as it relates to getting you guys scheduled with National Lewis to come out and host those virtual observations. And again, so because of what I just mentioned as it relates to the pandemic, we will be having to determine the future date as it relates to our ITERs and ECRs environmental rating scales, assessments of your environment in the classrooms. And thank you. That wraps our quality updates. I don't see anything in the chat, so I'll go ahead and pass it over. Next slide, please.
So I'm going to give it over to Nicole in a second, but I mentioned before that I was going to show you the expenditure rate. We are now in February of 2022. This is what we have expended on our ECBG grant from July to current, and we are only at 22%. And so looking at that 22% mark, only 17,835,699 has been expended. We are on track for a massive underspend because we've only spent 22%. So over 80% of this grant would have to be expended in the last 4 months of this year, of this program year, of this fiscal year, which is huge, which means you guys have a whole lot of vouchers that need to come into this system in order for us to even make a dent in this. And this is what we're really concerned about. When we pull these numbers and we can look across our full block grant, and this is PFA and PI together, only 22% at the, it's very, very concerning, both to us. And I meet weekly with the mayor's office and CPS, and we talk about our expenditure rates. And so understand that this is at the top of mind. This is at the top of discussions. This is an issue here. And CPS, of course, being the funder, if we're not going to spend the dollar, has to figure out a way to make sure the dollars are expended, because what happens is they're the ones who are in conversations with ISBE talking about expenses. And what that means is these are dollars that they weren't able to reallocate. But believe me, they're not going to wait until the end of the fiscal year without thinking about reallocating if we can't increase this expenditure rate. This is an issue. When you're looking at this, this is stark. I sat here and I looked at it and I'm like, okay, this is February and we only have March, April, May, and June. And trying to make sure 80% of those vouchers are in the system. And all of that is an issue. And I'm really concerned, and I just need all of you to see and understand my concern when I look at that. And when I'm in meetings, it's hard to have an answer for the lack of utilization on these funds right now. And again, I understand staffing, I understand enrollment, I understand all the things that we've talked about, and even the list of the why. But even now, even this year, it doesn't look like we're going to spend 50% of this 81 million, and that's a problem. There's a question, does that expenditure rate only include vouchers that have been paid? Yes, it does. Or does it include vouchers that have been submitted? Right now, what we went into is what's been in the system. And I will make sure that Nicole is saying that this includes all of your submitted vouchers. And so right now, what you're looking at is what everything that's been submitted in the system only comes to a 22% expenditure rate. And we are in February of 2022 with a fund over 80 million. And we're talking about sending back a good portion of that again. And when CPS is looking at it, they're looking at it and saying, feels like it's going to be more than 12 million, so Rachel, that's a problem. And so I'm here with you today to say this is a real problem. We have got to make sure that we're spending the money, meaning you. This isn't DFSS. We are contracting it out to all of you, but we've got to make sure that we have a way to expend the dollars. And for those of you who are struggling and are not able to expend it, then I'm going to want to meet with you so that we can talk through what kinds of things we need to be thinking about. Because I wanted to have some discussions with you before I'm having discussions with CPS, where we're looking at taking dollars back. Not being funny, but if we are on target, how can we help in spending money for other agencies? I don't know, but we definitely are going to be talking about what we need to do, because we cannot get down to the bottom of this year, this fiscal year, with all of these dollars not expended. There's no way we can do this. I know that there's been historical problems over the years with all of this, and I understand that we are in a pandemic. I understand what that's done as far as enrollment. I understand what it has done with your ability to expend your dollars. I am with you on that. And I am sitting at the table and I'm constantly talking about it. And I am responding to CPS, I'm responding to the mayor's office, and I am responding to leadership here in DFSS on your behalf. But I also have to say this to you. If it were just 2020 and 2021, I'd have more leverage. But I want you to understand, we have underspent this grant for the 4 years I've been sitting in this chair. There was 8 million the first year. There was a 4 million the second year. And these last 2 years, not this year, but the one before it was over 8 million, and this year is 12 million. And so my point is saying this has been a systemic issue of underspend. And this is why I'm talking to you today, because I want us to fix whatever this is and make sure. And I know trying to fix it in a pandemic, believe me, everybody has heard me from the hills talk about the fact that we're still in the pandemic and you're asking me to fix the world in the pandemic. Are we serious here? So I've already done that on your behalf, and I will continue to do that. But I need us to look at our agencies and try to figure out what might we need to do in our organizations and think about how do we use the dollars. And if you're not able to use all the dollars that you're contracted for, and we can predict and project that, then we need to talk about what do we do, because we can't keep leaving dollars on the table. That's not okay. And this is your funders speaking. We can't continue to do this. If agencies continue to underspend, I'm going to say that again. Can the funding be allocated next year? The problem is we are going to look at who's constantly underspending. I've got a report right now, and I can see the last 4 years for all of you. And I see what your percentages are from the last 4 years. And I can see who has not been expending their dollars, because I didn't want to look at the 2 years most current because it's a pandemic. And so I do have the 2 years prior to give me some idea of what has been a consistent issue for some people. And we're going to talk to you. We have to. I have a responsibility to talk to you and try to figure out what and the why. And we want to work with you to see, is it just not going to work? And it's okay to say that so that we can reallocate. Yes, we would reallocate. But we also need to understand what are the challenges. And if we did a budget revision earlier, might we be able to expend those dollars if we think about other ways that we can use our dollars in our house? And that's why we're talking to you today, to see what we might be able to do so that we are not leaving these dollars on the table. What I want to do is make sure we get as close to expended as we can. I want to show CPS that these dollars are needed in your hands, in your house, for your children, your families, and your staff. I want to work with you, but I need you to work with me and talk to me about what some of your issues are. I know how hard it is when you're going through everything that you're going through and the ups and downs that COVID has brought all of you, the opening your sites and the closing your sites, closing a classroom, losing children because parents are terrified, losing staff because they say they're coming back and they don't. I understand the challenges that you're having out there, but this is a historical problem that predates the pandemic. It goes back to when these dollars came over here. Okay. And so there's major overhaul and there's work that we're going to be doing, because we've got to figure out how to make this work across this grant and across the agencies that we fund. And so understand there will be some conversations, particularly with those of you who we can see across the board have had issues expending their dollars. We have to have conversations, and we have to look at this and try to figure out what we might be able to do. But right now, sitting here, and I monthly have to give this to CPS, and this is a number that CPS has looked at already. And so understand they are very, very concerned about this grant in our hands here at DFSS and the funding going out to agencies. Next slide. Nicole.
All right. Good morning, everyone. Thank you, Sarito. So I do encourage monthly analysis of your, as Sarito mentioned previously, your projected budget to your actual, so that you can anticipate any needs for budget revisions as soon as possible in order to increase your invoicing. And for this year, our revision deadline is going to be May 13th. So keep that in mind as you're submitting your budget revisions. We like to have final revisions by May 13th with the grant ending June 30th. That allows processing time and for you to get your final invoices in. For right now, we should have all 2021 invoices submitted. Everything through December 31st should be submitted. The deadline was the 28th. Currently, your accountant, Monica Almanza, is reviewing reporting. Anyone who has any missing 2021 expenditures, she's reaching out. What we can do is, if there, for any reason, you were unable to submit a 2021 invoice, we can report an accrual to our comptroller's office. And you would be able to then submit a voucher beyond the deadline, but we don't encourage this. But this is to assist you in ensuring that you're maximizing your expenditures. We did have a question about the voucher turnaround time. So typically it's within 10 business days. Now, because we are at year end, we tend to get an influx of vouchers. This is another reason why we encourage, not only because the funder requires it, but because it helps alleviate the influx if you are vouchering monthly and not submitting several months of vouchers at the year end cutoff or at your budget end date cutoff. So right now, because of the influx of vouchers, it has been taking a higher turnaround time in order for these invoices to get paid. But if you have any concerns, please definitely reach out and we'll be sure to reach out to the comptroller's office on your behalf. And in regards to budget revisions, so we did have a handful of budget revisions that were submitted closer to the end of the calendar year. And then they were being processed in 2022. There was a system issue where it was unreserving your budget in 2022. So we're working with our IT team to move those funds back to 2021. So any revisions that are currently in process right now with high in process times, that is the reason why. And we will be sure to notify you as soon as it is resolved and your budget is approved so that you can get your invoices in. And typically for budget revisions, I would say expect a 10 to 14 business day turnaround time. The revisions are reviewed first by the program division and then your finance accountant. And then the finance accountant sends it over to the comptroller's office, who then they typically take 3 to 5 business days to approve. All right, and here I just have the iSupplier link for handy reference materials and trainings that you can refer to. And again, if you ever have any questions on iSupplier, you can definitely reach out to us and we'll be happy to assist you or refer you to the right person.
Thanks, Nicole.
You're welcome.
And so this is a perfect slide for today, because we're sharing a mission of change, because the change here is to not repeat the last years on this block grant. It's for us to gain control over our expenses and our expenditures and making sure that you're able to utilize the dollars in your contracts. And our responsibility on this side, as I said a little earlier, is to really work with you to figure out the why. If it's going to be something that you're just simply not able to do, to figure out the why behind that so that we can then do whatever we need to do to reconstruct whatever is necessary. But we cannot, for all of you on the call, do this. There's some of you who expend your dollars, and I congratulate you and commend you. You do 100% each year. But I want to know, with those of you who are struggling, what is your struggle? And how might I, my team, the fiscal team here at DFSS, how might we be able to assist you? Again, some of the things I've said to you, I want you to think about budget revisions. Don't wait until the end and go, oh, wow, we weren't able to expend those dollars. If you need to do something different, the time now is to think about what that is. As the slide said, you can do another budget revision up until fiscal says no more. You can present another budget revision. Get your vouchers in. You can do more than one a month. I know we say monthly, but if you're doing payroll twice a month, voucher twice a month. You know, have the dollars in your coffers and not in ours, please. If you are going and putting things in and you're not getting back what you need, raise your hand. Don't wait. Don't wait months and then say, I'm about to lose my mind over here because I can't operate anymore. Don't wait until you get there. Talk to us before. What we have done when we get emails and people are saying, you know, I got stuff in the system and I'm struggling here. What we've done on our side is we've escalated it through the system. Nicole Roberts, who just talked from fiscal, has helped us. We, you know, Office of Budget and Management and others who we reach out to, they've helped us to help you. But I don't know what you need if you don't tell me. And that's why I'm here with you today, to reach out to you to say, please work with me, work with us. Let's do our best to get these dollars out the door to you so that you have them in your hands and you're working and doing what you need on behalf of children and families. I can't say it enough that I commend you for what you do every day. I've been in your seat. I know how hard it is, but I can say to you, I didn't do it in a pandemic. I've been on this side in a pandemic. So your struggle is different than some of my struggle because I wasn't going through that. Did I go through fiscal issues in the state of Illinois? Absolutely. Did I almost see things collapse around my feet? Absolutely. And it was a struggle. And so it's not easy, and I get it. But you've got people here who want to help you. We want to be your help agent. We want the dollars out the door. I don't like giving money back. I don't believe we should give any money back. That's just where I sit. When I came here, there was dollars that were being sent back on our federal grant and our state grant. And my question was, why? Why are we doing that when these agencies need these dollars for these children and families? I need to understand the why behind it. And so some of what we've done, we've increased some of the rates, we've made some changes, but obviously there's some other things that we need to do. And we're going to be considering that as we go through this. But I also want to work with you to try to figure out the why and what's going on in your house that may be something that's impacting you individually. And we'll be trying to see also what's impacting this grant and its utilization overall as well. But I do need to say to you, as we are getting ready to close this, and I'll see if there's any other questions and give you a chance to chat with me. If you can't spend the dollars, say you can't spend the dollars. I will tell you that I have my staff call and ask, send emails and ask organizations, are you going to expend your dollars? And what I get back is they're saying they're going to expend it. We say that to our fiscal department here. So they anticipate the dollars going out of the door because that's the message that we've gotten back. Sometimes we get somebody who goes, you know, no, I'm not going to spend maybe 12,000 of my dollars. And, you know, and we thank them for their honesty. Let me say this to you. If you're not going to expend your dollars, raise your hand and say that so that we can reallocate those dollars and get them out of the door. We here on this side, we put our dollars into your grants and keep very little for admin on this side of the house. And so the dollars are out there. They're not being expended and we're trying to figure it out. A part of those dollars are in the scholarship. So this is my last thing, and then I'll see if there are any other questions. A part of the dollars we've put in the scholarships because you need individuals with Pels, right? And so we're putting some dollars in scholarships. So I ask you, are you working with your staff to make sure your staff are enrolling in those programs? The UIC program, into the community college program, working and getting a scholarship, accessing it. These dollars are out there to help, to support you, to make sure, because we understand the staff shortage. We understand there's staff without credentials. So get your staff into these scholarship programs. Please, that's why we're putting the dollars where we are. But again, we're going to do everything we can on this side, and we're going to continue to talk to you and work with you on this. I can't emphasize enough on my last 3 points, and I'm just going to reiterate them. Number one, data entry. You've got to get everything in COPA on all of your children. You have got to get all of them in the system for all of your children, or your records are not countable, and then the numbers don't match. And so we've got to make sure that all of the required elements are in COPA, because when they go into when the ISBE report comes out of the system, every time it comes out, William's very nice in how he responds to me when I send him an email and ask him why, and he gives me the reasons for it. And he does it in a very, very nice way to let me know that the team is still working with agencies, because right now There's still elements that were not put in COPA, and they're on the phone, and they're putting in some of the information on behalf of the agencies, because we're trying to turn this around because we have a deadline from CPS. We should be at a point right now in 2022 where that's not necessary. I've been sitting in this seat since 2017, and that's exactly what we've been doing. It is 2022 and we're still doing that, meaning on the end of the enrollment, we're still not fully enrolling children. That is seriously a problem. And so the question is about support and COPA. We will do more trainings. I know there's been some trainings. I'm going to talk to staff when I get off. We're going to do whatever we got to do. Whatever we got to do, people, we're going to do it because we want to be 100%. And so I'm here today. I'm begging you to work with me, and I'm going to beg you to work with me as I'm going to work with you. Okay. The scholarship program is as far as the scholarship program that I mentioned, we've already allocated those dollars. You don't have to, Lynn, those are already done. We can talk to you about professional services. There is another question in the chat also about CDA books and classes. Let me talk to you about CDAs. CDAs, when it comes to a PFA classroom, because of the requirement of coursework, they need to get the college courses. So we need them to enroll in college and get those courses if they're the assistant in the classroom. We need the Pell if they're the lead teacher. Right now, that BA with a level 5 credential is countable only to 2024. So we need teachers on these tracks to get their Pels. Are you going to lose access to even the teachers you have by 2024? Because right now, ISBE hasn't given us anything else about moving forward beyond 2024. If they do, that would be great, but right now I don't have it. Tamela has put the link in there and the scholarship is open. We need people to apply. Okay, we need people to apply so that they can get access to courses and so they can get these degrees and credentials completed. Couple of other things that I do see coming in the chat: comprehensive COPA training. We got you. I see it. My team is writing that down. Can I repeat what I said about CDA? Can teacher assistants, the teacher assistants in a PFA classroom PI, I'm going to check my answer off the top of my head. Would be incorrect for me to do that. I'm going to check. I don't believe it is, but what I do want to make sure is that we are making sure that your staff are enrolled in getting college courses. There is a requirement for a level of number of college hours for that assistant in a classroom. Now, if that assistant has college hours and a CDA, that's fine, but the CDA cannot take over what the college the number of credit hours required for an assistant. That CDA is not countable and it won't cover it because there's not required. A number of course hours are not required in the CDA. And so it really ends up not being countable the way you would want it. Can it be an add to someone who's gotten the right number of hours? Yes, but it will not take over and replace. Can we pay on our own for college courses and back tuition? Back tuition holds their official transcripts and they cannot enroll. I'm going to tell you that is a problem. We're trying to pay the back tuition. I know that the community colleges did have some issues with that. And what I'm going to tell you is I will refer them to Truman, to the staff over at Truman to find out whether or not they can assist them in any way. And because we do know, and that's one of the work that we've asked them to do on behalf of staff that are in programs who are having issues, is to go ahead and work with those advisors at Truman College to see if there's anything through the scholarship office that's over there where they may be able to help them regarding that back tuition, because that is going to hold them up. They won't be able to go forward. They won't be able to get their transcripts, and that's a problem. There is a city cohort to help people prepare for Pell exams. William, if you can put that in the chat or make sure that information is available to folks. Yes, there is. We'll make sure you get the number of courses that are needed for a assistant, Dawn. Again, the number of courses that are needed for a CDA, and I'm going to say it out loud because I want to make sure everybody hears me. A CDA in a PFA PI classroom is not going to count because the CDA does not have enough courses in it to count for what is required in a PI or a PFA classroom. And so if the person is only getting a CDA, no. If they're getting course hours that are countable, with the right number of course hours, and we will send this out to everybody again on what's required, then they can do that. If they want to get a CDA, you want them to get a CDA, that's okay. But the CDA will not count alone because there are not enough credit hours to get a CDA in order to require that person or make that person eligible to be an assistant in your classrooms. And so be very careful with that, and we will work with you and send out more information. I worked with Truman before. They didn't have anything that helped as far as the back tuition. William and I will talk back to Sandy over at Truman. And if we get anything different, we will come back to you. We were working on some of that before. So William and I will go back to Sandy over at Truman College to see if there's anything we can do. And so I'm repeating again, Donna, CDA is not countable for a teacher assistant in a early childhood block grant classroom. There is a certain number of credit hours that person needs to have attained. And the CDA does not include that number of courses or hours. And so we have to be really, really careful with that. Regarding COPA, I know that Tamela put a note in there before. If you're having issues with enrollment, you can email Tamela, and she also recommended that you email William Hill here in the office, and between him and his team, if there's issues with enrollment, they can help you with enrollment and what your issues might be under the block grant. And there's the email address. Thank you, Tamela. The scholarship link is in the chat. And they're adding other information for you. I'm trying to see if there's any. Mary, I'm hoping that we are able to get some advocacy regarding the continuation of the alternative credentialing, because again, we're at 2022 and right now it is only 2024. And so what's going to help me, and I know my staff are gathering some information right now, is I need to understand what staff have in our classrooms. They're looking at it right now. I'm asking them to do it really funding by funding. So they're looking at federal right now. They're going to be looking at state next. We're trying to figure out exactly what is the crises, because we do need to advocate. I don't think that by 2024, we will have accomplished what we intended to accomplish with making sure that enough people had their Pels. Those people with the level 5 credential, the bachelor's in level 5 is going to end in 2024. And if there's no advocacy, I anticipate a problem. So we do need to advocate on behalf of this. Craig is on and he says, if you have any difficulty, he's asking you to log into COPA. There's a question in here regarding health tabs that are required in COPA. Yes, there are some tabs in COPA that are health that is required. And William, do we have a list that we can get out to everyone regarding health? And we'll get that out. I'm doing multiple things here, and William's going to send out the required field so everybody understands in all of the different tabs what is required to make sure that we're getting children fully enrolled, and all the data that we need is in there. But there's health required information that's in there. The screening information is required. And so those things are required fields that are in COPA right now.
You post the cohort information.
They're asking that the post the cohort information. William is going to, can you send that out via email, or what do we need to do for the cohort information, William?
So yes, what we did post was, in order to join the cohorts for the Pell and any of our other degrees or certificates, credentials sought through our scholarship, it is the scholarship application, and it will indeed get you or your staff into the enrollment process.
And so the cohort for those that are trying to pass the exam.
Yes. Yes.
Is that through?
That's done through UIC as well.
I'm sorry?
That is completed through UIC as well, through the scholarship.
Okay, great. Okay, thank you. And so UIC, who's also doing the Pell alternative, credentialing program, is also the one who's doing the help to work with individuals trying to make sure they're able to pass the required assessments for their films. I'm just waiting a second. I don't see any other questions come in. And I know it was a lot of information that we've given you today, but I just want to say again, the goal is for us to get these expenditures done, that we are not doing another year of turning money back. I know you can use it in your house. We just got to figure out the why you have not been able to, those of you who are struggling with it. Know that we're going to be following up with those of you who we see that over time, you've had some consistent issues with expensing these dollars, to try to figure out what we might be able to do and how we might be able to assist. But just know that we DFSS are going to have to make some decisions and some determinants before we get further into the year about what we're going to do, because again, we can't leave that amount of dollar on the table again, as we have before. Again, I understand some of the things that we put up on the screen. Some other things have been added in the chat regarding some of the challenges that you're having. We want to work with you to see if we can resolve or assist in any way. But at the end of the day, what we cannot do is underspend this grant at the level that we have. Again, we simply cannot do that. So we will be working with you. So I thank all of you. And I know it's a crazy day, the weather combined with everything else going on. And so I thank you for spending time with us today. As I said again, when we started, what we will be doing is we will pull away and we will do specific PFA PI so that the message is definitely a message to you about your programs and the requirements and making sure we're meeting your needs. We will continue to do the combined, and we will also do separate, as we have already with the federal funded agencies, because they're going through federal monitoring. That's not something that you're going through. And so there's some specific things that we talk to them about that we won't necessarily have to do that when we're talking specifically to you. We will keep you updated when we're meeting with you about what is looking like about our expenses and what is looking like in enrollment. We're going to still come to you, but I need you to tell me how to help you. That's what I'm here for. I'm here to help and I'm here to support. And I just need to know what you need. And believe me, we're going to be there with and for you through this because my goal is to have it not be an impact on any of you. I would much rather sit here and, do a happy dance. Nobody needs to see that happy dance. It's not really good. But I would much rather do a happy dance and go to CPS and say, we met the challenge. And yes, we were able to make sure those expenditures were met, versus sitting at the table talking about reconstructing this grant, people. So please work with me. Work with me on this, as I'm going to be working with you. Thanks, everyone. I see some thank yous, and I thank you. I know how hard it is to pull up and pull away for the amount of time that we're asking you to do. So I thank all of you for your spending time with us today. And again, you'll get invites. We'll be back together again. Do me one big favor in the interim is stay safe. Be very, very careful. Continue to do what I know you're all doing every day in your programs as you're mitigating, you're following the guidance, you're masking, you're sanitizing, you're cleaning, you're ... I know all of that is happening because I'm not seeing breakouts in COVID in your centers. And I have a COVID report, so I can see that as well. And so for that, I thank you because you're keeping yourself, your staff, and the families that we serve safe. And that's what this is all about. And now with the end of that, now keep yourself safe, because I need all of you. So please stay well and be healthy. And we'll talk to all of you very, very soon. Thanks, everyone. Have a great rest of your day.
Thank you.